Which of the following is not a risk factor for uterine leiomyoma? A. Smoking. B. Red meat consumption. C. Obesity. D. Family history. The answer is A. Smoking. The main risk factors for uterine leiomyoma are family history, obesity, and red meat consumption. Smoking is not a risk factor. Up to 90% of cases of pelvic inflammatory disease have what etiology? A. Human papillomavirus only. B. Neisseria gonorrhea E only. C. Neisseria gonorrhea E and chlamydia trachomatis. D. Chlamydia trachomatis only. The answer is C. Neisseria gonorrhea E and chlamydia trachomatis. 75 to 90% of cases of pelvic inflammatory disease are caused by Neisseria gonorrhea E and or chlamydia trachomatis infections. This condition, typified by adhesion formation in the uterus and fallopian tubes, can result in serious issues such as infertility, ectopic pregnancy, or reproductive cancer. Which of the following is part of the diagnostic criteria for pelvic inflammatory disease, PID? A. Fever. B. Leukocytosis. C. Elevated erythrocyte sedimentation rate, ESR. D. All of these. The answer is D. All of these. The criteria for diagnosis of PID are as follows: fever, cervical motion tenderness, abdominal pain, leukocytosis, elevated ESR, and purulent cervical discharge. What would be the primary concern in the case of rubella infection during pregnancy? A. Maternal ocular damage. B. Gestational diabetes. C. Birth defects. D. Maternal death. The answer is C. Birth defects. The primary risk in rubella infection during pregnancy is to the fetus. The rubella virus is able to cross the placenta, and acts as a teratogen by inducing apoptosis in fetal cells. This is termed congenital rubella syndrome. Birth defects can include deafness, ocular damage, cataracts, congenital heart defects, hepatomegaly, and developmental disability or delays. At what time during gestation is a fetus most susceptible to congenital rubella syndrome? A. The first 12 weeks after conception. B. Week 12 to 20. C. Week 20-30. D. Week 30 to 40. The answer is A. The first 12 weeks after conception. Infants who are exposed to rubella during weeks 0-12 of gestation have a 51% chance of developing congenital rubella syndrome. If the fetus is exposed to the virus between 12 and 26 weeks, the incidence of defects drops to 23%. Congenital rubella syndrome is rare in infants whose mothers were initially exposed to the virus after 26 weeks of gestation. Interestingly, the fetus is more likely to have birth defects if the mother contracted rubella before conception. Infants whose mothers contracted the virus 0 to 4 weeks before conception have as much as 43% incidence of congenital rubella syndrome, due to its long incubation period.